All right, welcome to this explainer, where we're going to dive right into the veterinary playbook to solve that deeply frustrating mystery of your endlessly itchy dog. If you're a dog owner, you know exactly what I'm talking about. It's that unmistakable sound of your dog thumping their leg against the floor at 2 in the morning, the constant licking, the scratching that literally just won't stop. Well, today, we're going to look at the exact step-by-step diagnostic process that veterinary dermatologists use to figure out what's going on. And more importantly, we're going to break down some absolutely crucial vet tips for treating dermatitis so you can finally get your dog some real relief.
So, here's our roadmap for today. We'll start with the pruritus problem, then move into Step 1, ectoparasites, Step 2, secondary infections, and Step 3, dog allergies. After that, we'll cover specific veterinary treatment strategies, and finally, how to break the itch cycle for good.
Okay, let's kick things off with Section 1, the pruritus problem, why the scratching won't stop. It's honestly terrible to watch your dog suffer from constant licking, rubbing, and chewing, right? It makes you feel so helpless. But to solve this, we first have to give this problem its clinical name. You and I might just call it the itch, but in the veterinary world, they use a very specific term that encompasses all of these distressing behaviors. Pruritus. That is the medical term for this agonizing itch. It's defined as an unpleasant sensation that provokes scratching, rubbing, and licking. In fact, it's considered the single most common clinical sign exhibited by dogs presented to vets for skin disease. But here's the really critical thing you need to remember. Pruritus is just a symptom. It's not the disease itself. It's basically a giant alarm bell ringing to tell us something is fundamentally wrong with the skin barrier. So to defeat it, vets don't just guess. They rely on a highly specific process of elimination. To find that root cause, we're going to walk through a 3-step clinical algorithm today. Vets follow this algorithmic approach almost religiously. It's brilliant in its simplicity. They start with the most common, easily solvable issues first, namely the bugs. Then they move on to ruling out infections, and only then do they investigate complex allergies. Skipping a step here? Well, that's exactly what usually leads to a dog having chronic, unresolved scratching. Let's jump into Section 2. Step 1. Ectoparasites, ruling out the bugs. Now, it is absolutely incredible just how extreme flea allergy dermatitis can be. You might look at your dog and think, hey, I don't see any fleas, so there's no way it's bugs. But for a dog with an allergy to flea saliva, a single solitary bite is enough to trigger a massive, full-body inflammatory response. They'll develop intense itching, hot spots, scabs, and significant hair loss. All of that from just one bite. It spreads like wildfire.
So, how do we actually rule these invisible culprits out? Well, your vet is going to use some specific physical tools. They'll run a fine-toothed flea comb through the coat to look for fleas, ticks, or that telltale flea dirt. But they don't stop there. They'll also go microscopic. They'll perform a skin scrape to look for burrowing Sarcoptes mites, which cause intensely itchy mange, or surface mites like Shaleatiella, which is kind of grossly but accurately called walking dandruff. And here's a pro tip. Sometimes, even if a skin scrape comes back negative, but the vet strongly suspects Sarcoptes mites, they'll initiate a treatment trial anyway, just to be absolutely sure.
Moving right along to Section 3. Step 2, secondary infections, bacteria, yeast, and hotspots.
So when a dog scratches constantly, they end up breaking their own skin barrier. This is a huge problem because it allows normal bacteria and yeast that already live on the skin to invade and multiply. This triggers acute moist dermatitis, which you probably know by its much more common name, a hotspot. These are localized, oozing, red, and incredibly painful lesions. And what's really terrifying is that they spread incredibly fast. We're talking doubling in size in just a few hours. To tackle this, a fantastic vet tip for treating dermatitis is performing a skin cytology. The vet will use a piece of tape or make an impression smear of the skin, and then look under a microscope to see exactly what specific bacteria or yeast is causing the infection. If they don't see organisms but they do see inflammatory cells, they might run a culture for ringworm. Now keep in mind, certain thick-coated breeds are highly predisposed to this, especially Golden Retrievers, St. Bernards, and German Shepherds. Why? Because moisture from swimming or bathing gets trapped deep against the skin, creating the perfect warm, humid environment for bacteria to literally throw a party.
All right, Section 4, Step 3, dog allergies, food versus environment.
Now, if the bugs and infections are cleared and the itch is still there, we look at allergies. But diagnosing allergies is a meticulous process of elimination. You can't just run a quick blood test and call it a day. In fact, veterinary research shows that serology and salivary tests for food allergies completely lack scientific evidence. Instead, food allergies require a strict diet trial using a special hydrolyzed diet. This means the proteins are broken down so small that the immune system literally won't react to them. Meanwhile, environmental allergy, or atopic dermatitis, is diagnosed purely by ruling everything else out first. You might do allergy skin testing way later on, but that's only used to formulate a custom immunotherapy serum, not to make the initial diagnosis.
That brings us to Section 5, Veterinary Treatment Strategies, Healing the Skin. Once the detective work is done, your vet will usually prescribe a multi-pronged approach to give your dog some much-needed immediate relief. Let's talk about some specific vet tips for treating dermatitis. For topicals, chlorhexidine shampoos and wipes are an absolute game changer. They gently wash away the bacteria driving those nasty hot spots. For medications, short-term oral or topical steroids control the violent inflammation, while antibiotics clear the deep infection. But listen, here is the absolute most important mechanical tip. You must use a barrier. A standard cone of shame or a specialized dog recovery suit is vital to stop the dog from continuing the itch-scratch cycle and traumatizing the tissue even further. And of course, you'll be deploying powerful oral chewables or spot-ons to completely eradicate any active parasites.
Let's wrap things up with Section 6, Breaking the Itch Cycle, Long-Term Prevention.
These actionable vet tips are your absolute best defense for the long haul. Number 1, maintain monthly parasite prevention all year round. Seriously, no gaps. If your dog loves to swim, thoroughly dry their coat all the way down to the skin to prevent that trapped moisture we talked about. You should also be hot washing their bedding at a minimum of 40 degrees Celsius and vacuuming your carpets regularly to destroy hidden flea eggs. From a nutritional standpoint, adding omega-3 fatty acids like DHA and EPA from fish oil helps build a really resilient anti-inflammatory skin barrier. And finally, don't underestimate the power of boredom. Use puzzle toys to keep their minds engaged so they don't resort to stress-licking their paws just for something to do.
I really hope this explainer empowers you to team up with your vet, follow that 3-step diagnostic algorithm, and stop the itch before it even starts. Remember, a scratching dog is just asking for help. By walking through these steps, checking for bugs, clearing infections, and carefully investigating allergies, you're not just throwing random treatments at a problem. You are fundamentally healing your dog's skin from the outside in. So I'll leave you with this. Are you just putting a Band-Aid on a symptom, or are you finally ready to treat the root cause? Go evaluate your prevention routine today. Thanks so much for joining me on this explainer.